Dr. Duminder Satal Singh here. The audience is now yours.
Okay, thank you, Nipani, and no worries at all. So, ladies and gentlemen, it's my pleasure to introduce Mr. Ajayakumar Hooli, a distinguished professional in the field of medical imaging as the today's speaker. Mr. Hooli is currently the MRI product manager at GE Healthcare India. He earned his master's degree in medical imaging technology from Sri Ramachandra Medical College and Research Institute in Chennai. With a career spanning several multinational companies in India and Singapore, Mr. Hooli has made significant contribution to the field of magnetic resonance imaging or MRI. His expertise lies in the research and development of new pulse sequences and their implementation, as well as in the introduction and strategic marketing of innovative MRI products. In his previous roles, he has collaborated with key opinion leaders from France, Belgium, and Denmark to shape the future of medical imaging products and its applications. Mr. Hooli is also an accomplished speaker, having presented papers on functional MRI at various international conferences. Currently, he leads the MRI product portfolio for GE Healthcare in South India and its neighboring countries, driving innovation and excellence in the field. Please join me in welcoming Mr. Ajayakumar Hooli. Mr. Hooli, we have allocated 30 minutes for your presentation, followed by 5 minutes question and answer session. Thank you, and the audience is yours. Mr. Hooli?
Yeah, hi. Hi all. So thanks a lot, Dr. Duminder, for your kind words. And thank you all for giving an opportunity for GE Healthcare to showcase the latest advancements of AI and the future of imaging. I hope you could see my screen. Please, if you could let me know.
Yes, clear. Can you turn to the presenter mode?
Just a moment.
Okay.
So, yeah, now. Just making it to a presentation mode.
Yes, clear and sound. Good.
Yeah.
You can move forward.
So, yeah, so artificial intelligence, I would like to also thank the previous session. Dr. Christie has given a very good overview of AI, and the positive things he's told about AI really inspires how it could change the society, how it looks like, right? So AI is something not very new. It is started at 1950s. I'll just run through a basic introduction and then move to the imaging part of it so that people understand that it's not new. It's a very old concept. Only it evolved with computational capabilities across time. So if you see, as time progressed, as your computational capabilities, your computers have advanced, the ability to crunch the data, as Doctor was saying, the data is increasing. The ability to crunch the data and get the useful information is dependent on the computational capabilities of the computers, which has evolved over years. So now we are seeing much more applications, much more things in the AI. So the Andrew told that there will be no industry which would think about AI. So it's not about healthcare. It would be everywhere where we would like to get help on. So if you just see the healthcare industry itself, it would be a 14% of the entire GDP of the globe, contributing 15.7 trillions in money and 55% in productivity. So 55% of productivity, that is what he was mentioning, that enormous improvement in productivity, which could help to cater more and more patients with more efficiency, right? So today, day to day in life, as he was telling, like we all use all these kind of applications, Google Map, Facebook, Netflix, everything uses some part of AI, which understands how do you work, what do you like, and based on that, it will customize and show you what you want to see and what you want to access to, right? I hope everyone would have experienced these applications. Similarly, going ahead, there are very innovative things like you can have an AI lawyer, you can have your fitness coach as an AI, so forth, so on. In radiology, there will be many companies which may not make CT or MRs, but they could help you in diagnosis. So lot of innovations. It's not like eliminating the roles of the people or technologists or radiologists. Basically, AI will assist, or as doctor said, it would augment their roles. It will make their roles better and better, right? So just to give you the size of the data, 48% of the data, that means around 50 petabytes per hospital, That means it's like a million gigabyte, a quadrillion bytes. That kind of a data is processed, okay? And it's 48% growing year on year. That means every 2 years, it is doubling, right? So now, just to give you a gist of how the errors are now today at radiology, the error across detection of diagnosis and treatment, we see it as 4%, diagnosis for pathology is 4%, treatment at 5% error rates, plus or minus 5%, right? But if you see, for last 7 years, the accuracy has tremendously improved from 71.8% to 97.3%. It is surpassing the human capabilities and effectively playing a bigger role for making better decisions, right? It is assisting people to get a better decision, better things. So if you see, artificial intelligence is actually demonstrated by machines, which is somewhere equivalent to natural intelligence, right? It is similar to natural intelligence. So it starts understanding and interpreting. There are different levels of AI, of course. I just want to give you 3 major things which people talk about AI when they talk. So AI is basically a machine to try to mimic, or try, like your kid mimicking you, what you do, right? So similarly, ability of machine to mimic human intelligence, right? AI. So machine learning is ability to learn data without being explicitly programmed. So you are programming it to learn new things. Machine learning is that. Deep learning networks. So this is most complicated with the advanced form of which doctor was talking in the later stage. It's basically a neural network. So it's basically the way human brains analyze things based on its previous past, right? So maybe like an example here, if you see, if you give bits and pieces of the images, you can put them back together. So by just seeing this one image, which is dog face, immediately human brain consumes it as a dog, a full-scale dog, and not wolf, right? This is how system also starts predicting it. That is how a neural algorithm works predictively, right? So descriptive analysis, predictive analytics, prescriptive analytics are 3 different ways things are done at progressions, right? So how the data is collected, how it is analyzed, and then how the decision tree is arrived at. So it's basically, it consumes the data, it crunches the data, it analyzes it, and then it will give you the results. So over the period of time, you would have seen the maps have completely become better and better. They are now showing you live data with traffic and everything, right? It is analyzing, and also it is suggesting you the new routes where you could go, right? Similarly, in the healthcare, if you see, there may be n number of technologists who are working in a hospital, right? There are 5 or 6 of the technologists who are working. So if you see their clinical rate of or their performance across, how do they take and perform in clinical? Maybe some are very experienced, some are just new to the source. But having a predictive analysis or the softwares which are there, which could help them to improve their output, you can improve their productivity or so they would produce better and better output with the help of AI, right? So I'll not go into the numbers of here. So there are different parts to it. There are softwares, there are machines which uses these softwares, and how altogether they would reduce your time across. So basically we learn how your hospitals or the system works. Then we try to deploy algorithm which we have done into our softwares that would be consumed by you people to use and improve. So if you see this image, so basically data is taken in, it is analyzed, it is annotated, basically understands which are the parts of anatomy, and then it gives an inference. It basically reports. It basically says, oh, maybe there is an issue at this part of the area, right? So this is kind of reporting or helping reporting to say how the precision of health in future, right? Basically, the applications will show you if there are pathologies. It will help and guide you to see the areas which are affected or which are not normal. So that's how it changes. So today, basically, it's paper, it's IT, it's manual steps. So he was saying there's a lot of documentation, lot of paperwork, lot of everything. So all these are automated to improve and become more and more less use, and everything is automated by the computers. So what if your scanners in radiology work smartly, right? So they work in three different ways, three different time points. If you see before scanning, at scanning, and post scanning. After scanning, basically, post scanning is after scanning. So if you see the first pre-scan, what all is important for us? So sir was saying that you need to understand how the patients are scheduled, which patient needs priority. If there is a myocardial infarction, he needs a priority, right? Or if there is some pediatric patient, if there is a diabetic patient, priorities have to be done based on your scheduling. So that scheduling, patient scheduling, is also driven by AI and deep learning. It understands the situations of patients. It prioritizes based on that. So basically, the needy gets the first. It understands the electronic, your medical records, risk, lab reports, everything. So it suggests you how your schedules could look like, and you could, of course, rearrange it across. And the patient should be most what do you say, benefited with this kind of analyzing and giving them the special treatment based on their requirement and their urgencies. So next comes the scanning. So in scanning, if you see how better you could acquire images, how better you could consume the data and make the images, right? So basically, the deep learning helps you to get the raw data and make good images out of it, so that you should not repeat the scans or repeat the images or repeat the X-ray exposures, right? That is how it will help. So your rejection data will be less. You don't have to repeat. So your productivity increases. Some examples for ultrasound. So basically, the deep learning understands this is a head, what you're scanning, right? And now if you move to the next, abdomen, it says it's an abdomen, what you are seeing where there is heart, right? So basically, it also assists radiologists, the even the students, to learn faster and effectively. Similarly, in CT, now we have even auto positioning cameras, right? So I'll just show you a video how it works so that you understand how automatically machine understands the patient position and aligns to itself, which will in turn helps to reduce the dose and you don't have to repeat the scans just because the positioning is not right, because the patient takes care of, the machine takes care of positioning. So you just select if you want to do a chest, and the camera scans the entire body. It understands where is the head, where is the chest, where are the legs, right? So it precisely selects the anatomical points and the FOV which you have to scan, and exactly get the center point of your body, which is not visible for the technologist to center at, right? Usually we do it at the surface of the body, but here the entire body is contoured and the targeting is done at the center. So the radiation dose is given correctly. So radiation safety is taken care of. So you don't give the overdose to the patient. So AI helps in maintaining the patient safety in several ways. So exactly that point is centered. And you can scan the right part and only the required part. Right. So similarly, there are different kind of intelligent scanners available in the market, from ultrasound to CT to MRI. So MRI, I have a couple of images which I could show you. These are basically CT, where the dose reduction and the artifacts are taken care of. MR, you see, there are a bunch of applications which are quantitative. Now, MR is moving towards quantitative data. Why I'm stressing on MR is it is a non-radiation, non-ionizing radiation technology. It is much safer. You can repeat scans, but with AI, the repetition could be less because the machine understands your requirement, gives you exactly what you want. It can give you data values, it can give you quantifications across different applications and procedures. So it also improves your image quality across. It removes the artifacts which come sometimes because of wrong parameter selections, wrong positioning, and so forth, so on. So better diagnosis, less repeatability again, right? So the post-scan is most interesting segment, where even in this segment, a lot of big companies are working towards making inferences, basically helping radiologists to get the right diagnosis, right? Of course, they are very expert, but if someone could suggest this may be the problem, it would really help them to do their work faster and it as easier, right? So basically, if you do an X-ray, if you put an AI algorithm for your X-ray, you see the AI potential findings shows that it is a pneumothorax, moderate or large. What confidence level? It is 97% confident that it is pneumothorax. So doctor could see, he could accept the report or he could reject it, and he could give his own diagnosis. Similarly, for liver segmentations in CT, it can give you right volumes. It can understand. It helps to accelerate your working, basically. So it gives you everything prepared as a chart, as a report. So it helps a lot in terms of speed, in terms of accuracy. Definitely, once accuracy improves, the safety increases to a greater extent. So basically, if you see few example for stroke management, stroke is why important, because it has a very less time window, right? You have to diagnose, you have to send the patient for a treatment, what kind of treatment he has to go through, whether it is a bleed, whether it's an obstruction, whether you want for thrombolysis or not, right? So basically, if the automation happens, it will help to do it faster. So it understands which sequences has to be compared and given the right data and input out. Right. So basically, the device workflow is been explained here. I'll not go into depth on that. So similarly in prostate, basically it also helps. to understand and say where are the lesions. Prostate is a very small anatomy. It has to have a high precision, high resolution scanning. So what we have seen is this kind of software has helped and improved in NIH, especially in London. They have made this study where we have seen that precision has improved very high, right? Whether it is malignant or not. So if you want to do it with cartilage assessment, so it is applicable for entire body, all anatomies, different regions, different asks. The algorithms are being defined. So it is been developing and it is becoming more and more accurate and more safe. But only thing is, yeah, of course, the awareness should be there to have such kind of latest and state of the art technologies which could help you to do better, right? Having said that, I would like to conclude. I will not take much time. I think I'm almost there of 30 minutes. So the future of AI means radiologists spend less time in reading room. Technologists do less repeatable jobs. They could do much better in terms of patient care by spending more time with the patients rather than worrying about the images, right? So every step, the precisional health, the AI would assist you, would help you, and also they would be. Sorry, any questions there?
No, Mr. Hooli, you can continue.
Yeah,
Sorry
sure.
for that disturbance.
So, no problem. So that's it. I would like to conclude. Thanks for your patience. If any questions, please do let me know.
Okay, and thank you, Mr. Hooli. Now, time for the questions and answers. So if you have any questions related to the presentation or about his expertise, then you can forward it to the chat box. Okay, you can raise your hand and directly ask the question. So and also thank you, Mr. Hooli, for your informative and constructive presentation. And this is kind of an good presentation that I have heard recently. And thank you once again for that one. And so I have one question for you, Mr. Hooli, until the questions are coming from audience. So now, can you explain how AI has helped in reducing the scan time and avoiding multiple sequences in MRI? So that is, of course, we know the fundamental drawback in MRI, the multiple sequences and scan time. So that also we can improve the efficiency, I hope. So what is the new advancement like?
Yeah. So thanks for the question. It's a really good question, which I would love to answer. So in MR, there are multiple sequences. There are multiple, different clinical needs for multiple sequences. So seeing this was a question which was being asked from a long time, from the 80s, that can we do one sequence and get all the information? So today we have an answer. We call it as MAGIC. So the sequence name is called as MAGIC, or a synthetic MR, where you do one sequence, you get multiple contrasts, and also they are quantitative. And today they are even motion corrected sequences. So one sequence you can do for 4 minutes and you can get all kind of contrast. If you want, I'll just show you that image. I have that in my PPT in the last slide.
Yes, please. You are mostly welcome. You can share.
Yeah. So, yeah. So if you could see that. So it's basically one sequence which a Bloch equation. We extract the information of different TRT values and we try to reconstruct at different time points of the data. So you get T1 flare, T2 flare, stir, PD, even double inversion recovery, all kind of sequences, right? In future,
you can't see the slide.
Sorry?
Yeah, Mr. Hooli, would you like to share your screen or you just?
Oh, okay. You're not able to see. I'm sharing it. So are you able to see now?
Yes, clear.
Okay. So if you see, the magic sequence gives you T1, T2, T2 flare, stir, PD, even double inversion recoveries, different kind of pulse sequence. It is all one sequence, okay? So one sequence of magic can give you 5 to 8 sequences of conventional scanning. It's just 4 minutes. It also comes with a motion correction. So it's a real marvel in the MR industry where it could save a lot of time, but also give you a quantitative data. So you get a T1 and T2 quantitative data basically. So T1 and R2 values, especially in dementia and all that, if they want to see hippocampus R2 values, they could see very quantitatively. So it's only one sequence. So like this, there are a lot of advancements in MR today. Deep learning itself, we call it as A-recon based deep learning method. People differently call it as different vendor names, smart speed, deep resolve boost and all that. But ultimately what they do is with the neural algorithm, they crunch the raw data and give you a better image without artifacts, uh, without errors. So the AI is helping radiology to improve on its errors and become more productive.
Okay, and thank you for that explanation. And I hope that by improving the diagnosis and making the workflow very smooth, then also we can improve the patient safety and diagnostic accuracy. And as a continuation for this same question, so is it a proprietary area or just on a research basis? This one, is it implemented?
These are commercially available. Today, these are commercially available. 5 years before they were research, today they are commercially available.
Commercially available.
Yes.
Okay, that means by this means, so since we are mainly focusing on the patient safety here, so is there any possibility, Mr. Hooli, that one day that CT can be replaced by MRI, or is there any synthetic possibility? I hope you are the best person to answer that.
Oh, thank you. Thank you again. Yes, it is a possibility. Now we have something called as bone imaging. I'll just throw you, I didn't include that in the slide, but I'll just quickly share that one of the slides which I have just to show you how it looks. Now MR can give you very subtle imaging of bone. For certain cases, definitely it is much useful. So just 1 minute, I'll just share that slide with you guys. So if you see here, so the upper row is MRI, right? The lower one is CT. So now you are getting as equivalently good as CT, okay? But yes, of course, you cannot completely replace CT, but definitely for certain class of images, you can definitely rely on MR. You don't have to go to CT now. Like pediatric bones, there are hairline fractures. If there are, you want to see certain things in pediatrics or a pregnant woman, MR would be much safer. And if you want to confirm, there are cases where they routinely do, where they send scans for MRI, like MRI knee, and they will ask for CT cuts also. Now you don't have to take CT cuts. You can do a MRI bone imaging so that you avoid radiation, which will definitely more safe for the patient. And also you can improve your productivity because you don't have to block two different machines, MRI and CT, for the same patient. So in MRI itself, you can do CT and take him out. That way it would save time tremendously.
Okay, and thank you once again. And I think it's getting very interactive because we have so many questions online.
Oh, is it?
And okay, and so I'll move to the first question, Mr. Hooli. That one question is from Mr. Gamage, and he's asking, when we are using AI in imaging, how far have they become able to replace the contrast media? this I was also planning to ask from you. Basically, MRI, yeah, how far they have replaced the contrast? That means even low dose contrast can you utilize? So, is there any method?
Yeah, so I'll give you an example for both CT and MRI. Just to start with CT, CT requires a lot of contrast, right? So the new techniques like dual energy CTs, like where you get spectral CTs, you can use spectral CTs and decrease your contrast dose. In fact, eliminate certain dose. You can get better metal artifact reductions. You so basically it will enhance those parts much higher with less contrast. Okay, that is one of the techniques in CT, spectral CTs. In MR, we don't require contrast only. Like we have 3D ASL, which is arterial spin labeling, we call. So especially for the stroke patient, which I was talking about, right? In arterial spin labeling, if you use, it actually excites the blood only. The blood will become the contrast. You don't have to inject an external contrast to it. So the MRI understands the flow of the blood will give the signal back. So based on this, you can see the perfusion in brain. And diffusion is definitely don't require contrast. So you can see diffusion perfusion mismatch. And also you can decide whether to which therapy you should go for. And it is quantitative on top of it. CBF, you get a quantitative values. So definitely there are a lot of applications in MR where you can replace contrast, where we have a spectrum of non-contrast imaging, especially for vessels and other stuff. To certain applications, it is improving day by day also. Yeah.
Okay, and that also, thank you for that explanation as well. I hope Mr. Gamage he got the answer for that one. And we have another question, Mr. Hooli, that they're asking, I think specifically they're asking about the GE, because in Sri Lanka also we have several GE MRI machines. So they're asking whether it is possible to buy the product or else the application for the available MRI. I hope they are talking about that AI generated, what you call the magic one.
Yeah. So a good part for GE is, what I love about GE MRs is any GMR, whichever, even it is 20 years old machine, we can upgrade it to the latest technology and give you all the latest applications based on AI.
Okay.
You can purchase it any point of
Yes.
time. Yeah.
Yeah, that's wonderful. And there's no any restriction about the Tesla value, whether it is 1.5, 3 Tesla, whatever the thing, no issue at all.
No issues at all.
Super. And so then, so one question, I don't know whether this is in your expertise, but they're asking, because there are multiple participants from various backgrounds here with us today. So one question is from Dulansa. So she's asking, how far AI technology is used in medical laboratory? So if you have answer with us, then totally fine, or else you can give the answer.
No. So yeah, means I have a very limited answer to it. What I have heard with my colleagues, and I've seen things developing at that point, that side also. The AI also is improving tremendously in laboratory technology. There are a lot of automations. It also helps in getting or understanding the variations in the pathological reports and helping them to get into the right diagnosis. There are definite improvements, but at present I am not right guy to give you the right application details of what all exactly happening, but definitely there is a lot of improvements happened on the medical laboratory front.
Yeah, anyway, we'll be having in more future presentations for that, I guess. And that means in laboratory science, even you can prioritize the requirements and the patients and which patient needs the attention first based on the AI analysis. That's what your answer is, I guess. And so from my side, there's another very important questions for you, because now you have shown that the GE has found an innovative solution so that you can replace the scan range in CT that using the automatic detection mechanism. But that mean that you don't need the scout imaging? Because I'm more concerned about the radiation safety. That's what I'm asking.
So now you require a scout image. It takes a scout image, but the radiation given for any scout image will be very less compared to previous one, because you know exactly the center point, how much to be given, what is the body mass index of the patient. So system calculates it and reduces the output of the tube, X-ray tube, right? So becomes more safer. In fact, that will also continue with your actual scans. So your tube life will increase at the same time. Uh, your patient will get less dose.
Yeah, okay. Yeah, that's thank you for that explanation. And I think we have one last question for you. And so Mr. Janit is asking, so can I know how AI is developed in tissue harmonic imaging and in tomosynthesis? Tissue harmonic imaging. So you have any?
Is it something with ultrasound? I would say ultrasound. So I showed you how in ultrasound AI is developing in terms of identifying anatomies, labeling them, and also going ahead. If you just take a screenshot of a kidney or you take a image of a kidney, it will give you a measurements in 2 dimensions automatically going ahead. And also in tomosynthesis, CT, basically CT, we have discussed in elaborately how the AI is definitely improving across. I hope that should answer the question.
Yeah.
If
So I
anything,
can add one part for that, because this tomosynthesis mainly, I think it's related to the mammography, and they have
okay.
by that they have reduced the requirement of taking CC and MLO, which are the basic 2D views. So
Yeah.
instead of taking those 2D views, they can take a 3D tomosynthesis view, and they can reconstruct the 2D views. So that in case you can reduce the radiation dose, and you don't need to do the 2D scans again and again. Only a single tomosynthetic image is sufficient. So
Yeah,
that's why,
mammo, yes, definitely, yes. What you said is,
yeah. Thank you, Mr. Hooli.
yeah, thank you.
So, and it's coming, I think it's becoming more interactive, and the participants
No,
are
no
very,
problems. I have time. If you
yeah, we also have time, and no any restrictions regarding that, since you have finished your lecture on time. And they're asking, is there any job safety or improvement in the job safety regarding in the health field with AI in future for the job safety, of course. That means I think they are fear of losing the jobs, that you told that radiologists will one day can be replaced with the machine learning and AI.
So, see, as even the previous presenter told very explicitly, it is very, very difficult uh, in near future to replace any human cognitive skills, right? Uh, Maybe 99 times AI is correct, but the extra part, see, it is always like this. All the patients, especially 99 patients you are treating and one patient, you can say like it's okay. No, it is not like that in medical field. Every patient is important. So even that 100 patient who requires that special care and a different experience from the radiologist uh, or the surgeon requires human intervention. Okay, so AI will tell this may be the possible thing, but the last stamp or the last signature should come from the human to say, yes, we agree that this is the one, right? So that confidence is comes to the patient only by the doctor. So what we see in next near future, in maybe 10 to 20 years, I don't see any job losses, but in fact, I would say a radiologist who is reporting 20 scans today may start reporting 200 scans. It may improve his economical viability. It improves to cater more patients. The you see, like there is one very experienced radiologist who is there, and that opinion from him is very important for very critical cases across Sri Lanka. So across Sri Lanka, all critical cases, he could spare time and give his opinion by looking using AI. That way, the healthcare will become more reachable to patients with AI. It's all positive, nothing to worry on job losses or anything of those kinds.
Yeah, I would thank you, and I would like to add one point to Mr. Hawley's answer. So we should not worry because the AI is trained from the data that the humans fed in. So anyway, they are basically based on the diagnosis that the radiologist has given, and from that data only they are training the model. So anyway, human interaction will be there, and most of these models that I have seen in the research sector, even more than not 90% accurate. So those are between 80 to 95. If I'm not correct, please correct me. So
No,
there is
right,
no
right,
100% correct
no,
algorithm yet so
no,
far.
no,
Yes,
and it can never be 100%. There will be
100%.
very exceptional cases which computers may not understand sometimes. It requires emotional interference. It
Yes.
requires to talk to the patients and understand their state. There are a lot of things which humans do, which machines will never be able to. That's what is the today's stand.
Okay. And one last question, I think. So this is maybe they're asking about the cardiac interventional radiography, and they're asking, is there any possibility to have the dimensions of a plaque in real time when stenting in terms of cardiac intervention imaging? They're asking whether real time can they take the size and the dimensions of a plaque so that it is very easy. I don't know that this is beyond your expertise, maybe.
No, it's a it's a great question, but I think it is not yet possible. I have not seen it happening anywhere at this point of time. When you say real-time measurements, that means uh, actually you are acquiring the entire data at real time and processing at the same speed to give you the measurements across. Uh, no, at this point of time, as per my experience, maybe in some places it is there, but as per my experience, I'm not seen across. But yes, the more and more computational capabilities increase, this should be a reality very soon.
Yes, so it's a good point for a research, I guess.
Yes.
Okay, audience, are there any more questions, or I think we have answered almost all the questions that the audience have forwarded us. And okay, and is there any last word from your side, Mr. Holy, or?
Oh, yeah, I would love to thank you once again from the heart, and I am excited to see such a crowd which is more interested in such advanced features, and you are conducting at a national level including government staffs and everything. Such awareness is required for healthcare. In fact, it's an inspiration thing which I saw. I could also tell back in India saying that we should have such conferences. It's definitely a very, very good educative initiative you people have taken. I would like to thank you with heart, and thanks for the opportunity again.
Okay, thank you, Mr. Holy, once again. And also, I would like to thank Mr. Amila Rajanayaka, the Deputy General Manager of Access International Private Limited, Sri Lanka, for his assistance in coordinating with Mr. Holy, the distinguished speaker of the night. And also, my special thank goes to the audience for your active participation in the session and your enthusiasm. And this is kind of an significant mile forward that for the better future of our field. And thank you once again, everybody. And this will mark the end of the session. And thank you.
Thanks a lot.
And is Nipuni? Yes.
Thank you, Dr. Duminder, and our esteemed speaker, Dr. Ajayakumar Hooli, for your stimulating presentation as well as the interesting discussion. Sure.